Welcome once again to Get Moving TV. Our children in Ventura County have so many services available, but we really need to make sure that they know about them, that their practitioners know about them. There's so many things we can do to prevent problems in health. The First Five has worked very hard to help bring these services to the enlightenment of both parents, pediatricians, professionals, really everyone who takes and interacts with children. Today we have Dr. Kim to talk about fluoride varnish. Dr. Kim, can you tell me a little bit about yourself and about the program?
Sure. I'm a family practice doctor with VCMC Ambulatory Care, and I became interested in fluoride varnish when I interacted with the First Five and Ventura County Public Health advocates. And when I saw how efficacious the treatment was, I thought this is something for sure that we should adapt in primary care. The problem of childhood cavities was studied and published by the CDC in 2005, and they released data that shows that in the poorest children, those whose families make less than 200% of the federal poverty line, these children have decay rates of 40% and 25%, and these are untreated. It's higher when you look at these same children in terms of what was treated and untreated, but this is just untreated. So especially, and it's worse in the children who are 2 to 5 years old. Most dentists out there are not that many pediatric dentists, so most dentists out there, if they're practicing general dentistry, will accept children 5 to 6 years old. And some pediatric dentists have limits too, and they won't accept children any younger than 2.5 years old.
Well, when should we start thinking about teeth? When they emerge from the gum line, just those little baby teeth, aren't they going to go away anyway?
As it turns out, that's exactly when you're supposed to start to take care of them, is when they emerge, because it turns out that the enamel, the surface on the teeth, is very soft and weak in babies. It gets stronger and stronger for adults, and so we're more resistant to decay, the damage caused by bacteria. But for the babies, their teeth are softer, so they're much more vulnerable to decay. And if they lose their teeth early when you have to extract them because they're so badly decayed, their jaw loses the stimulation of having the teeth there as they chew and use their mouth. And so what happens is their jaw might not grow as big as it needs to accommodate all the permanent teeth that are coming through. So, and then there are all the other obvious problems you think of, the esteem, that kind of, the pain, the terror of going and having all this work done.
Well, we really show our face and our hands to the world. That's how we represent ourselves. So it's really interesting that the whole face changes if you don't have good teeth and get a good start on it. I'm very happy that we're getting a chance to educate parents so they know to ask their pediatricians and family practitioners. Whereabouts do you practice?
I practice in Sierra Vista Clinic, one of the Ventura County outpatient clinics in Simi Valley.
Is this going to be available throughout Ventura County? Are you educating all the family practitioners and pediatricians to really be more aware of this program?
I am in the Ventura County system so far. I might expand that range, but right now I did this as like as a more focused assistive intervention in our system to augment the kind of public awareness and education that First Five and the public healthcare educators are working on in terms of doing individual private practices and disseminating information among primary care physicians.
Well, why are babies' teeth, we talked a little bit, they're softer. Is there anything else that puts them at more risk?
Well, the problem with the baby's teeth is that, in all of our teeth, is that there's dangerous, or I should say very strong, aggressive bacteria in our mouths. And some people have more than others. So this is called, it has a very yucky name, Streptococcus mutans. And so they have found that when people have high levels of this very strong bacteria, this bacteria likes to eat sugar. That's why dentist office call them sugar bugs. They like to eat sugar, and then and when the byproduct of doing that is that they make acid out of that sugar. So that's what actually melts away the enamel, dissolves it, so that then the places for decay can start. So that's the problem. And what happens is saliva has a natural role in our mouth to actually try to clean away that acid that the bacteria make. And but apparently the saliva takes about 30 minutes to do its job. So that's why you always have heard dentists always recommend don't eat between meals, and limit your snacking and not sticky foods. Well, so it's for these reasons. If you just by itself, I guess it is a problem to do that. You see plenty of people, it's part of our culture really to have breakfast and get a craving and drink or eat something around 10 and then eat. So we're all doing it and eating definitely more than 3 times a day. But it's a multifaceted problem in the sense that if you never clean away the plaque and never brush, and if you're doing this high frequency ingestion of starches and sugars, then you're kind of layering the problems, and then you're not using, for instance, you don't have the protection of fluoride in toothpaste or this varnish treatment that we're educating about. Then all those things work together to make these cavities happen.
Well, when you say cavities, are there mild cavities, moderate cavities, severe cavities? What should I be looking for as a parent and as a pediatrician? Are there can you help guide me there, this plaque stuff you were talking about?
Oh, sure. So I think we all think of cavities, we have a picture in our mind of what a cavity looks like, and it's always of a molar with a black spot in it. That's kind of what I always thought of as a cavity. But when you look at especially very young children, and this is what the program is for, is to help make a difference for these very young children and help avoid this course of traumatic treatment later. In very young children, the problem is going to be usually in their very first 4 teeth that they get in the front. So, and it's worse in the top teeth than the bottom, because the bottom is where all your saliva pools. So the top teeth is where things might stick, and so there's not as much chance for the saliva to rinse away everything that it's supposed to. Also, the saliva can't rinse away stuff if your teeth are very close together. If you notice a lot of baby teeth, most children with baby teeth, they have a lot of space between their teeth, and that's supposed to be there. It's supposed to help. Then that means that there's plenty of room for the permanent teeth to come in later. It helps them not to get the cavities in between. So I always thought of flossing as an adult thing, but it's not. Some children, you really need to watch and floss in there when their junctions are really tight, because that's where this sugar bug web of their net of old decayed food and that white junk that they line up, that is their net that they use to trap more sugar and set up a very nice house. And I tell parents all the time that if you give your child the milk right before bed, even after you brush their teeth, you've just given the food to the bugs to have a party all night.
Well, besides good brushing, when is this dental varnish applied? Is it just for little bitty babies? You apply it once, or?
No, and you know what? I just remembered when I was explaining about the problem of the course of decay that I didn't mention that you can see on the teeth the changes of having that plaque there where the bacteria are living. So what you'll see along the gum line, which is where it collects along the gum line, and at these spots, these tight spots between their teeth, you'll see this white goopy junk, and if they've brushed that away for you to see, or when you do the exam for the child and you scrape that away with your glove, you will see a lighter line of brighter white under there, which you'd think white was good. In this case, white is bad, because that means that that's where the acid is already softening the teeth. And so before you get to black, you will get this white line. And so what's sad often when I see children with cavities is that I know that they actually had that white line before, and it wasn't seen, because most of us in primary care, we're not really trained to look for those things.